Take it away, Karn.
Good morning and good afternoon. Today we're coming live from Langley, BC. Rahul's coming out from Calgary because he's decided to ditch me and move out there. So we're doing our first live podcast in separate provinces. And then today's very special guest, we have Dr. Upneet Chawla. She's out all the way in Chicago, Illinois. That's did a residency, and she is a sleep specialist. So, Dr. Upneet Chawla, welcome to the show.
Thank you. Thanks for having me.
This is awesome because me and Rahul, we've actually been looking for sleep specialists for a long time. And as I mentioned to you off air, that it's hard finding somebody that's comfortable enough to be on camera to actually have a conversation versus just coming in and doing a diagnosis because you're confined in your quarters. You got somebody coming in asking you direct questions, exactly what needs to be done. And today we're going to get a little bit personal just to learn a little bit about your
Yeah.
background and also get questions answered to sleep. Uh, because one of our missions on our podcast is to find ways to become more productive in our lifestyles. And sleep is one of the things that's neglected most from our young adult lives to teenage to adult lives when we have kids till we get old. So we got a lot of questions. We're going to compact it into about 30, 45 minutes. So we're going to look to you for guidance. And then hopefully by the end of this, we'll have a little bit more knowledge and maybe we'll be sleeping a little bit better day after day
Yeah.
after day. So, Dr. Chawla, can you just start off by telling us you started in Virginia and you ended up in Chicago, Illinois, or
Mhm.
how'd you end up in Chicago?
Yeah. So I did my internal medicine residency in Ohio, so in the Midwest, and then I matched for my sleep medicine fellowship here in Chicago. And then I ended up staying on at the place that I trained. So I've been working here for about 3 years now.
Why sleep though? Of all the things that you could have gone and practiced, why sleep?
Yeah, so I did a rotation. I think it's relatively new sleep medicine, compared to all the other fields of medicine. I did a rotation later on in my residency. I didn't go into my residency thinking, oh, I want to do sleep medicine. But when I did the rotation later in my residency, I realized how important it is. And I realized the effect, kind of the immediate effect that you see patients having. And also it's a great work-life balance as well. Not many emergencies or late nights. You're not getting phone calls in the middle of the night. So, and then just learning more about it, I've become really passionate about sleep itself. So,
Have you noticed a difference from when you first started your residency and even before? Can you think back to think like, oh man, I could have done this better in sleep, and my parents could have done this to help me out, and my siblings could have made a little bit less noise. You ever think about words when you know what you know, and then you start implementing it later on in life?
yeah, I mean, when I was in my training for med school, sleep was not at all a priority. In fact, it was low on the list.
Why do doctors
So,
do that? Or why do residencies do that where they just want to deprive you of sleep?
well, I don't think they mean to do it, but there's just so much information that I think any med student out there who like past or present can say they've pulled all-nighters before. It's
Mm.
just a part of studying and just cramming in all that material. So yeah, my sleep was not a priority before, but then when I started my fellowship, I
Mhm.
realized, how important it is. I switched like habits myself and I sleep a lot better now. And I feel like I'm, how you guys were saying, I'm more productive. I'm in a better mood. Yeah, it's been life-changing.
Do you have family members coming up to you and saying, hey, we need some diagnosis, or do you just start telling
Yeah.
people? Yeah.
All the time. Friends, family, I can't sleep, fix me.
Do you ever show up at a party where it's like 11 o'clock? It's like, hey guys, we should be wrapping this party up. Or you want to, or do you
No.
like to take time off and actually mess up your sleep a little bit to have a good time?
Yeah, yeah. Sometimes, on the weekends we have I forgive my sleep hygiene. I do like sleep hygiene cheat days. You know
Yeah,
how people do diet cheat days, so I can do sleep hygiene cheat days too.
that's funny. Okay, cool.
Yeah.
Let's get started with the first question is, what are the most common sleep problems that you see in your patients?
So in
And just
my
in
clinic,
general as well.
what's that?
Patients and just in general as well.
Patients, I definitely see sleep apnea, and I don't know if you guys know much about that, but a lot of people who come to me saying that they're super sleepy throughout the day, they're snoring, they're waking up a lot at night, can't focus throughout the day, having like memory difficulties. They're tested eventually for sleep apnea, and I think it's also the most commonly underdiagnosed um, sleep disorder out there. Basically, it's a problem of your upper airway where you kind of have these pauses of breathing throughout the night. And what happens is when you go through different stages of sleep at night, right? Light to deep, multiple times in a night. But when you're trying to get into that deep sleep, if you have these like sleep apnea events, then it prevents you from falling into that deep sleep. And so even if you're sleeping 10 hours a night, even though, the recommendation is 7 to 8, but even if you're sleeping more than that, if it's not good quality sleep, it's not going to be good for you. You're not going to feel refreshed. So sleep apnea is very common. We also see a lot of insomnia. We see narcolepsy, which is when people can fall asleep into their REM sleep really fast. We see certain like parasomnia, sleepwalking, sleep talking. Then there's other disorders that aren't as common, like REM behavior disorder, sometimes periodic limb movement disorder, things like that.
Does that have something to do with breathing in through your nose or your mouth when you're sleeping, or is that completely irrelevant?
No, it's more like the upper airway gets obstructed, so it doesn't matter so much if you're doing breathing through your nose or your mouth, though a lot of times people can have obstructions in their nasal pathway, like if they have a deviated septum or something, which could affect their breathing during sleep. But obstructive sleep apnea specifically is more the upper airway obstruction.
There's a couple things
Question.
that are,
A question.
I just want
Yes.
to ask before you say anything.
Okay.
There's actually products in the market that help you breathe better. One are those nose strips that people put on their nose before going to sleep to help them, and the
Hmm.
second thing is mouth tape. So
Yeah,
then,
I've seen that. I feel like it's all over social media now, the
yeah,
mouth tape.
is that a thing?
So there are studies that show that if you breathe out of your nose, it does affect, people are kind of, I think that the way that they're advertising it is you get kind of a nicer jawline. But it does affect the anatomy, the shape of your anatomy. There are a few studies out there that say that it might affect cognition a little bit. So ideally, yeah, we do want to breathe out of our nose. Do I think it's like everyone should be using mouth tape? Probably not. If you're having sleep issues, it's probably best to go get it checked out first, because what if you have sleep apnea, where your airway's obstructing? And some people, they then compensate by opening their mouth to take a breath.
Mhm.
Yeah.
You said that this is the most underdiagnosed with sleep apnea. Are people developing sleep apnea, or are they born with it and it's just not being recognized early on?
Yeah. No, I think it's just something that it's under tested, it is often people who are kind of more obese, or they have this like really strong snoring that's waking other people up at night. These are the people who eventually go get tested. But I think that we should have a lower threshold for testing it. So I don't think it's like developing more. I think it's been there. I just think we've been kind of testing this subset of people, but I think more people should be tested for it.
Mhm. And then, like, I feel like if I had sleep apnea, I would know about it pretty quickly. And I'd go see a doctor and say, hey, like, I'm not sleeping at nighttime. I feel restless. I feel anxious.
Yeah,
What's the, yeah,
but sometimes, people, they've just been feeling sleepy kind of forever, and they feel like, oh, well, I'm just kind of aging, so this is just the norm for me. And it doesn't have to be. They don't know what a good night's sleep feels like, so maybe they just, or they
they're
don't know
unaware.
about sleep apnea. Yeah.
Yeah. So, okay, hold on. Is there some truth to that? So as you get older, do you sleep less?
Well, you get less deep sleep. Yeah.
And
Yeah.
is that
Our
like,
stage 3 sleep is our deep sleep, and that decreases as we age. Yeah.
is that like just programmed in our genetics, or why does that happen?
Yeah, it's just part of the aging process, unfortunately. That's why you'll see older people generally wake up earlier.
Is there a quality of our rest determined with less sleep as we age, or are we still getting good quality sleep?
I mean, if you have to compare it with people in that same age range, right? Like if you're comparing me with a 75-year-old, it's going to be different. But so the quality of sleep just changes as we age. But if you compare it with someone in your own age group, there's other things that can affect quality too, like these disruptions at night by like sleep apnea or other sleep disorders.
Between sleep apnea and a regular sleep person, there's
Mhm.
growth hormones that are excreted throughout the night when we're sleeping to help us grow and help us recover. It- Does it necessarily mean that sleep apnea people are just gonna have more fogginess, or the person that's getting better quality sleep is gonna come out smarter at the other end? How does one play with the other, like especially with the brain fogginess during the day?
Yeah. So the growth hormone part is more in younger kids, which yes, younger kids can also have sleep apnea. I am an adult specialist. I don't really treat kids.
Mhm.
So I'd have to probably look into that specific question. But when you're talking about the brain fogginess, that is definitely apparent in people who get disrupted sleep. That's one of the signs or symptoms of sleep apnea. I would encourage someone who feels that to go get tested for sleep apnea. But it's basically, it all comes down to getting that disrupted deep sleep. So when that deep sleep is disrupted, you're not able to function as well as you could if it was not disrupted.
Okay. How do we optimize our sleep schedule?
Oh, um, okay, so you want to get 7 to 8 hours of sleep. That's recommended for adults
So this is my
our
whole.
age.
I feel like I sleep 7 to 8 hours. I don't necessarily know that I'm sleeping for 7 or 8 hours, but I do know that I'm probably just like tossing and turning. And I do know, because I feel like I'm a light sleeper, of when I'm turning from one side to the other side. How do we know that that 7 or 8 hours is being optimized for sleep?
Yeah. So waking up is normal during sleep. I know a lot of times people come in saying with and this is, we can get into this topic later, but sleep wearables or trackers are the new thing. And so people are noticing that they're waking up. You're going to wake up regardless. It's normal to have, 4 or 5 awakenings at night. So long as you don't remember it the next day, it's fine. And you should really focus on how you feel when you wake up. If you're feeling really groggy, if you can't get through the day without a nap, if you're unable to focus, you're having that fogginess,
Mm.
those are warning signs that maybe your sleep is not optimal.
Okay, cool. So my sleep is definitely not optimal. What
Because why? You feel tired throughout the day?
I feel tired, yeah, pretty much throughout the day, but then the way that I carry myself, you wouldn't know it. And then the other thing is I won't drink coffee because if I do take coffee, I'll just be off the rails. I have enough energy to just like go, 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 but I do
Yeah.
know that I sometimes feel drained. So how do I get my energy levels up? Because I do know there's been a handful of times in my life where I wake up and I'm like, wow, I feel great. And it's like a commercial and the lights are going. Uh, but I gotta sometimes I gotta force myself out of bed. Like I'll hit the snooze button at least 2, 3 times, 15, 20 minutes. I'm in bed, and then I'll finally like begrudgingly I'll get up. Is there something that I can do, uh, like pre-planning stages or while I'm sleeping, that will be consistent in waking up happier and less of a mood?
You should probably get a sleep study because maybe the quality of your sleep is not good.
Sleep study. Okay.
Yeah, like see
Dude,
a sleep doctor.
Karn sleeps so much. Like it actually amazes me. So the fact that he says he doesn't sleep a lot is like a throw off for sure.
No, and that's what I'm saying. I'm in bed a lot. Like I'll be in bed for very like long periods of time, but it's not that I'm necessarily sleeping.
Yeah.
Okay, that can work against you actually.
Okay.
So that there's time in bed and then there's total sleep time.
Yeah.
So ideally, the time in bed should be about the same only like a little more, right, than your total sleep time. If you're staying in bed awake, doing things other than sleeping, on your phone, reading, I don't know, eating, homework, emails, whatever it is,
So easy.
that conditions your brain to think it's okay to be awake doing other things in bed. And it's a term, it's called conditioned arousal. And so
Tarn does all of that. He's like texting in bed and stuff. But I do that too, so I can't.
You have to wait till you're sleepy to get into bed.
Yeah. I have a question. So like you said, like we should sleep 7 to 8 hours.
Yeah.
I've always believed in like variability. So like, you know how naturally some people are big and muscular, some people are smaller, some people have skinnier bones. I've always thought like sleep should be a spectrum based on other factors, like again, with genetics plays a role, but like your body weight, your height, is that important at all?
No, I think it's just for adults, it's 7 to 8 hours, but I see where you're coming from. There's a small population of people, and it's a genetic thing where it's called short sleeper syndrome. They're called short sleepers, where they really feel fine after like 4 to 5, max like 6 hours of sleep. But the average adult who does not have this genetic variant does best with 7 to 8 hours. That's why it's recommended to do 7 to 8 hours.
So I've actually heard about those people that sleep like 6 hours and they feel just as good as someone that sleeps 8 hours. But so like, how does like your diet and how does all that play a factor in sleep cycle? Because normally, like, just to give you like anecdotal evidence, if I'm more active in the day, I find that I sleep better and probably longer. I haven't timed it myself, but I'll wake up, I'll feel like I slept better maybe. Does that play a factor at all, or?
A little bit. The more that you're being active, your body is getting tired. Is it going to affect your sleep stages? I don't know about that, but it might help you fall asleep faster, even though it's not recommended to do heavy, intense exercise close to bedtime, because that can actually do the opposite. Your body gets a little bit more adrenaline and it can keep you up later. As for diet, eating late at night also not ideal, because your body wants to do the digesting before you sleep. So eating late at night can also keep you awake at night. Types of diets and sleep, I don't know much about that. I haven't heard too much about it. I haven't come across a lot of data on that, but I could look and get back to you.
I find generally if I eat less carbs, I don't sleep as much. So maybe it's because I'm hungry. Yeah, if I'm on like a keto diet or whatever, I usually find I don't need as much sleep and I'll wake up sharp and clear. I don't know if that plays a factor.
I don't know if it affects your sleep, but it could affect like your cognition a little bit. Yeah. But I'll look. I don't know about, at least in my training and my few years of practice, I haven't really come across a lot of strong data on types of diet affecting sleep stages.
Got it. Makes sense. Sorry, there's people walking in and out.
That's okay.
So okay, what are some like ideal sleep hygiene habits? Like I'm sure you talk a lot about that with your patients. You want to touch on that a little bit?
Yeah. So sleep hygiene, I think, is underrated. I don't think people take it as seriously as they should. And that's kind of what changed for me too. Kind of what I touched on: no heavy exercise, no heavy meals, no alcohol before bed. Caffeine has a half-life of 6 hours, but can affect people for longer than that. So try to stick to maybe only in the morning caffeine. And what I personally do is I dim my lights 2 hours before bed, because the light is the biggest wake promoter. So when I wake up, I try to get some sort of, I open my blinds, I try to get some sort of sunlight. It's best to go outside if you can get direct sunlight. But then at nighttime, I kind of dim the lights, because that can help secrete melatonin a little bit too, which helps make you sleepy. So basically and I'm just keeping a same schedule, same sleep time, same wake time, avoiding these things right before bed, and maybe dimming the lights a little bit, maybe even taking a warm shower an hour before bed. But these can help. I think the biggest thing is that most people have trouble with is sleeping and waking up at the same time, because we're all young adults here and we all have a social life. And so we may stay pretty strict during the week. That's what I do. I stay very strict during the week, but then on the weekends, I'm out and about. And it there's a term for that too. It's called social jet lag. So if I'm sleeping at 10 during the weekdays, but then maybe midnight or 1 on the weekends, my body thinks that I traveled somewhere and came back. And so the next few days, it's going to take a while for my body to readjust. By that time, half the week is already over. Right. And then it's like the cycle happens again. So that affects us a lot more than we think. So keeping the same sleep and wake time, I think, is pretty huge. And then all the other little habits too can help.
I want to touch on jet lag. So we fly out for work and for business trips all the time, weddings. How do we reset our body for jet lag to be able to appropriately wake up and not feel so tired when we're in a different time zone?
You would have to start preparing for it like a few days in advance. So it becomes kind of tricky because yes, there's ways to do it, but then it's hard because it affects your actual daytime schedule of what you're doing at that time. But ideally, if you are traveling west, you want to delay, right? And east, you want to advance. So it's all about timing. There's like a chart on it too that I can send you guys if you really want it, but
Yeah, please.
timing melatonin and then timing exposing yourself to light. So it's all about shifting your circadian rhythm. All has to do with mostly light because it's the strongest wake promoter, and then a little bit melatonin as well. And it's all about the timing of when you take that. But ideally, you want to shift it little by little, a few days before going. But it also depends where you're going, because if you're going to a whole nother, it depends like how many hours difference is the time zone. So it might take longer to shift.
Are you talking about melatonin, the pills?
Yeah.
Do those actually work?
Yeah, I think so, but you have to be careful. You have to be careful because I think people are trying to make melatonin be this sleeping pill, but it's not. It's just to help shift your circadian rhythm. So it's not meant for people who have insomnia. It's meant for shifting your rhythm. So for jet lag or for shift work, like I do nights sometimes. I work nights at the hospital and then I shift to days. And when I'm trying to shift my schedule, yeah, I can take a melatonin in it and it helps.
What's happening in people's bodies when they have insomnia?
It depends. I mean, it could be, it's either trouble falling asleep or trouble staying asleep, right? So there's no quick fix for insomnia. There's all these sleeping pills out there, which can help you basically sedate you kind of to fall asleep. But are you treating the problem at hand? Hard to say. The number one recommended treatment for insomnia is CBTI, which is cognitive behavioral therapy specifically for insomnia. So maybe you've heard of CBT for people who have anxiety, depression, other kinds of mood disorders. So there's a specific one for insomnia, because a lot of times people who have insomnia, it's almost like an anxiety around sleep.
Right.
Yeah.
Then how about the people that say marijuana helps them sleep better?
Anything that kind of helps you sleep, this is kind of a rule of thumb that I've noticed, generally affects your sleep stages or your sleep quality pretty negatively. So marijuana, alcohol, even these over the counter like ZQuil, antihistamines, all these things that make you feel really drowsy, they can help you fall asleep pretty quick, but then they affect the quality of your sleep later in the night. Like they affect your deep sleep, so a lot of the times when people take this kind of stuff, they'll notice, right, that they feel a little bit more groggy the next day. They fell asleep fine and maybe they got more sleep, but it wasn't the right quality sleep.
What would you say to the people that are taking different type of medications and pills for I guess, altering their sleep or making it
You
better.
mean like
From
sleeping
stress,
pills?
sleeping pills, especially for stress and anxiety.
So stress and anxiety would be different than sleeping pills.
Mhm.
So if stress and anxiety is what's causing the insomnia, then yeah, there are medications to help treat the stress and anxiety.
Mhm.
Now, if it's just a sleeping pill, which is basically a sedative, it just kind of like knocks you out. It's
Mhm.
not really treating any stress or anxiety. It's just knocking you out. And those can become addictive. And then eventually you build a tolerance too. Not ideal to stay on long term. So that's why I always recommend people go look for CBTI, because then they can actually figure out why they're having the insomnia versus just kind of, I almost think it's sometimes putting just a band-aid on it. It's making you sleep, but why are you unable to sleep? You have to get down to the actual problem.
Yeah, I feel like a lot of these drugs are just promoting to get the symptom to go to sleep, but not really
Yeah,
finding out what the root is. Do you actually have people that you work with that you send your clients that sometimes they might,
yeah.
yeah, you know that there's
So
something wrong with them, like it's not just sleep, there's something a little bit more. Do you ever say, hey, you know what, maybe talk to a specialist in the health and like mental and health department versus just taking sleep pills?
yeah, we have in our clinic, we have sleep medicine, which is what I do. Then we have something called behavioral sleep medicine, or BSM, and they really focus on insomnia. So it's a lot more behavioral than it is just like a quick fix with a pill. Like you really need to figure out what's going on, and there could be lots of things. It's not always just anxiety, stress, some kind of mood disorder.
Mhm.
There could be other things, maybe you have kind of a delayed circadian rhythm.
Mhm.
Some people, they just find that they sleep better at 4 a.m. and wake up at 11 a.m. And that's hard because society is not going to support that schedule, right? We need to go to bed at 10, wake up at 6.
Mhm.
So they have to really get to the bottom of what's going on before just prescribing a pill.
Mhm.
I have friends that say that they work better at nighttime, like they
Yeah.
can think clearer. Is that a real thing, or
Yeah. Yeah,
it
they
is?
probably have something called delayed circadian rhythm. So we all have this circadian rhythm in our bodies that's kind of programmed in there, right? I always ask people, if you didn't have any responsibilities, if you're, on vacation, or you didn't have to wake up for any meeting, work, anything, what time would you get sleepy and go to bed naturally? And what time would you wake up? And that is probably your internal circadian rhythm. For some people, that's 4 a.m. to 11. And so that person probably has a delayed circadian rhythm. So they would have to use bright light therapy and melatonin to slowly a lot of times people work from home nowadays. And so if that works for them, that's great. But if they need to shift their schedule a little bit, bright light therapy and melatonin are the key factors for helping to treat these circadian rhythm disorders. There's also a opposite of that. There's an advanced circadian rhythm disorder too. So maybe someone really just can't stay awake past 7 p.m. and then they wake up really early, 2, 3
Mhm.
a.m. So for
Right.
that, they'd have to delay their rhythm a little bit.
Okay, if I
Yeah.
wanted to like sleep less so that I can be awake more, can I take supplements to do that? Like I want to sleep 6 hours and then go at it. Is there any way to shortcut that sleep time?
No, I don't think sleeping less is going to be helpful. It's about just trying to get that 7 to 8 hours, unless you're one of the short sleepers. But no, I don't think there's a supplement out there that can replace sleep. I mean, if we found that, we would be
Uh-huh.
billionaires. So
Right. Right. I just think a lot of people don't ask that question. It's like, how do I get the same
it's a good
quality of sleep
question.
in less time?
Well, remember, you're going through the stages, right? So you need that time to cycle through all the stages. The deep sleep is not the one that comes right away. You have to go like light to deep, light to deep. So that's why it's recommended to get 7 to 8 hours so you can get the right quality of sleep, the recommended quality.
In your studies, is there a reason why we go through these sleep cycles, or is there like a reason why we've developed this way? Like we're talking natural selection type stuff here.
Yeah, I don't know the answer to that. I don't know why we cycle through. But all mammals need sleep. So we know that it does something for us, you know?
Uh-huh. Interesting. Okay, is there an animal that doesn't need sleep?
Not a mammal, but there's
Fish don't
probably other animals.
I don't think fish sleep.
Yeah, they're
I have a
not
stupid
mammals.
question. Do cows sleep standing up? I've heard that.
Do what? I
Do
don't
cows
know.
sleep standing up? I think I've heard that before.
I think so, but I don't know for sure. But I think so. I don't know.
Why can't I sleep standing?
I don't know.
For
That'd be
you, we're
great,
gonna
huh?
have to hang you upside down.
Oh, like a bat? Yeah.
Like a bat, like a vampire, Dracula or
Yeah.
something.
Dude, it would be so cool if you could ask these questions and try to find answers for it. I want to sleep standing up. Wouldn't that be so cool?
That would be cool. I don't know how. Well, okay. When you go into your REM sleep, which is your rapid eye movement sleep, your body becomes basically atonic. You lose muscle tone, or paralyzed, I guess, lack of a better term. Your mind is super active. You're dreaming, your eyes are going, and then you're breathing still. But I guess if we were standing, you would fall then. And it's kind of almost like a protective mechanism, because otherwise we'd be acting out our dreams, because you're dreaming and your brain is really active at that time. And so we generally become like we can't really move in REM. And actually that's what REM behavior disorder is. That's when that protective mechanism is lost in some people and they do act out their dreams.
Mm-hmm. So is that what happens when people are sleepwalking?
Walking, yeah.
Different. It's a little different. These are now parasomnias. So it's like an abnormal behavior during sleep. So the way we differentiate is it's in REM or non-REM. So sleepwalking is a non-REM parasomnia. So it's happening in your other stages of sleep. But REM behavior disorder is happening in your REM sleep.
Mm-hmm. So like,
It's a little bit better.
if I wanted to sleepwalk, let's say tonight, my goal was I'm going to sleepwalk tonight. How do I prep for that? How do I get myself to do that?
I don't think you want to sleepwalk because it could be a little dangerous. You don't know what you're doing. You're asleep, right? So you don't want to get in the car or, I don't know, start cooking, burn yourself, hurt yourself.
Right.
So I'm going to advise against
are there
that.
doctors or scientists that actually try to make this happen in a controlled environment?
Not that I know of. So
I think they've
that's
done
where
it.
the learning is. That's where the learning is.
I think they practice that with lucid dreams, and actually touch on lucid dreaming and creativity. Would you happen to know anything about that?
No, I feel like there's not a lot of data. It's really hard to get data on dreams, right? Because you can't know what the person is.
Yeah.
Right. In your studies, like I've Googled this stuff. So like I've had a dream where my teeth fell out, and then I Googled and I was like, oh, you're feeling anxious about something. And that's why in your dream is there any correlation between what you dream and life?
I don't think there's any scientific data proving that I have come across. Maybe there is that I haven't seen, but I have not come across.
I have so many questions. I want to sleepwalk. I want to dream about specific.
Yeah, I'm a little concerned for your safety, to be honest.
Okay, is there some sort of connection to what you think about late at night, about what you dream about? Is there any correlation there? So like, I'll give you an example. I remember like when I was in school, my grandma used to be like, sleep on your textbook. So I would take my school textbook and I would put it underneath my pillow and sleep on it. And so it was weird, but in my dreams, I would start thinking about whatever I was learning about. Is there
I
any
think
correlation to what you think
I
about?
think there must be some level of subconscious correlation to dreaming. I just don't know the scientific data behind that.
Mhm. And not to make this conversation kind of wonky, but like, is there some connection to like manifesting things in your sleep? Is there like some sort of things around that?
Not that I know of. Maybe I'm not the person to ask these
Of these,
questions though, because
like,
I'm
what did
very.
you just ask?
He's a sleep specialist,
No,
not
I'm
a
just
dream
thinking,
specialist.
what's that?
Sleep specialist, not a dream specialist.
Yeah, it's just I practice evidence-based medicine, and so I just haven't come across a lot of the scientific data
Mhm.
to
Is
back
a is
that.
a big is a big part of what you do related to like research at all, or not really?
Yeah, there's a lot of research. I work at an academic institution, so there are some, research studies that we're doing. We like to kind of stay on top of the research that's coming out too. So I try to stay up to date as best I can.
Are you monitoring
I'm
people?
pretty serious. I'm pretty serious about sleepwalking.
Okay, we're gonna have to have a talk after this and advise strongly against that. So
I just want to know, what's the purpose, Rahul? What do you want to do while you're sleepwalking?
you're
I
not
think
gonna
it's like
remember it.
if you can, yeah. So it wouldn't really be for me, but it'd be for science overall. So if you can like make things happen, I think the understanding around sleep and how it works would probably be decent. Again, it's just how my brain works. No.
No.
Sounds pretty dangerous.
Yeah, sounds a little
I feel
sounds a
like
little
you wake up and
risque to
start
me.
cooking bacon, making sales calls.
Yeah, you can start doing things that might be out of character for you or that could be harmful to you or to someone else. So please don't endanger yourself or others.
Is there something, do you think there's something that's our parents and our grandparents, they've been teaching us or telling us about sleep? Like how Rahul's nanny and grandma were telling him to sleep on a book and the information will go through the pillow into his brain. Is there something that your grandparents taught you or told you that you look back now thinking, oh man, this was actually scientific, but these guys were just not educated?
I don't think so.
Warm glass of milk. My grandparents always used to say, have a warm glass of milk
Almonds,
and that'll
right?
help you.
Almonds.
Almonds, yeah, almonds, the
If
fats
you
You
and
can
drop
have
stuff.
this.
paper on the ground, you like kiss the paper. I don't know.
Kiss the paper? No, no, nothing about kiss the paper.
No, I mean having a snack before bed sometimes can help people who might have like an episode of hypoglycemia that might wake them up, just like a low blood sugar in the middle of the night. But that's more people who have, diabetes or other problems with sugar control. But I don't think that there's any kind of old wives' tale that I came to realize was actually scientifically backed.
Yeah. There's actually something to do with sleep dreaming. And I don't know how much you go into this, but there was an article. I'll find it and I'll send it to you and you tell me how much credibility it is. But it was based off of a doctor taking case studies that they had to go into like an ER room the next day. So he would take the case, he would study it before going to bed, and then
Mhm.
he would dream about how to operate on the patient in his sleep and then wake up the next morning and then perform that surgery for that second time, and he would have 100% success rate. Is that something that's possible that we could just and I think this touches back on what Rahul was talking about earlier, is just dreaming about the things that we need to accomplish and then waking up knowing that we've already done it a first, second, and third time.
This is out of probably my scope. I don't know. I really don't know about dreaming a
Okay.
lot.
So you just want to put people to sleep. What happens after
I
that?
no, so sleep medicine is really just making sure that people are getting the best quality sleep
Right.
and having them focus on things they can do to help them get better quality sleep. And then whatever sleep disorder they have, we can help diagnose and treat it.
Right.
But I mean, these are all fascinating questions, and I would love to read that study that you're talking about, but I just have not a lot of experience
Last
or
question before we move on from the goofiness. I heard
okay.
if you drink a glass of apple juice before you go to sleep, you can have wicked nightmares. Like the craziest things. I haven't tested it because I'm a bit of a
Huh.
scaredy cat, but do you think that's like, is there something in apple juice that will make you go crazy at nighttime with your nightmares?
I don't think so. Melatonin can cause nightmares though,
Oh, okay.
but not I don't know about apples
What
So
or apple
apple
juice.
melatonin,
juice?
hold on, melatonin can cause nightmares?
It can, yeah. It can cause you to have nightmares. It does
Why is
happen
that?
to me sometimes when I take it.
Why?
I I don't know for sure, but it could be because it's just helping you fall asleep. So maybe you're getting more of your dream sleep, and maybe those dreams could be nightmares. But there's not like a causation
Correlation, yeah.
correlation.
So like melatonin is one that comes up, but what about like tryptophan? Do people supplement tryptophan?
Tryptophan makes you sleepy, yeah. Yeah, so that's
Okay.
why people for Thanksgiving, well, I don't know if you guys don't celebrate Thanksgiving, but when we do Thanksgiving here in the
We have
States
a
and we
Thanksgiving
have
here. Thank you
turkey.
very much. Very
You have,
American
oh
of
right,
you.
yeah, it's different. Sorry.
We celebrate your Thanksgiving, okay? We don't celebrate our own. We celebrate the American Thanksgiving.
Okay. Well, turkey has tryptophan, and tryptophan can make you sleepy.
Oh, that makes sense now. It's no more than like everybody gets super lethargic after a nice
Eating.
Thanksgiving
Yes.
dinner.
Yeah.
I mean, mine is with shai paneer and naan because I'm a vegetarian, but I'm guessing for the turkey, they're just gone.
Yeah.
Okay. Um, during our binges, right before going to bed, chocolate is one of
Binges
them.
on what? Oh,
Binges on like
on
candy,
food.
chocolate, because we're talking about different types of food. Is there one type of food that you would suggest everybody should be taking before going to bed to get like crack on like good amount of sleep, or is it more about timing your sleeping and what you're drinking before you go to bed?
Timing. It's the timing you're sleeping and then habits before sleeping, but there's no kind of magic meal, pill, food
And
that will give you the
I could have sworn a warm glass of milk before going to bed was just maybe
if
it's a
that helps
placebo.
you, then that's fine.
Well, now that I know that's a lie, I'm never gonna trust my grandma again.
Well, I don't know if it's a lie. I mean, it might help you sleep,
Yeah.
but it doesn't have any sort of secret ingredient that's
Okay.
gonna just fix your
Okay. There's different
sleep.
type of sleeping apps that we have. There's some of them on our phone. There's different types of rings, and we can wear
Yeah.
our watches to get us to sleep. How accurate are those to track how well we're sleeping at nighttime?
Okay, see, now you're talking my language. So this is actually something um I've looked into a lot. I do a grand rounds presentation at my university on sleep wearables and technology. So all these things like the Tempur-Pedic, the Aura Ring, the Fitbit, the Apple Watch, there's tons of them. I mean, tons that are out there for consumers. And studies show that they're pretty good at telling you whether or not you're sleeping or you're awake. So they can tell you if you've woken up at night. They're pretty good, about 90%
Hmm.
accurate, I'd say. But when they claim to say that they can tell you your stages of sleep, it's about 50 to 60%. So if it's saying your light sleep, your deep sleep, I wouldn't trust that
How could they
very
make those
much.
claims though? If you're going into deep
Well,
sleep.
they use surrogate markers, right? They're looking at your heart rate, they're looking at your movement, they're looking at sometimes light
Hmm.
sensors, things like that. So they can guess if you're, if you're more still, or maybe if you're a little bit more active, what stage of sleep you're in. But that has been compared with a sleep study or a polysomnogram
Hmm.
in the studies that I've looked over, and the correlation is not that high. So it's about like 50 to 60, but that's like a coin toss,
Hmm.
Is there a certain wearable that's more effective at reading sleep cycles, or they're all kind of about the same?
I think from what I've read, they're about the same, but I do know that there's, every year there's a new one coming out. Even like the Aura Ring and the Fitbit, that the studies I read, it was like 2 years ago. Now they have another one. So you've got to read those studies, but then those studies takes a little time to get those done, to conduct those studies. So that data probably won't be available until next year. I did hear that the Samsung, I think there's a Samsung that was recently, just this year, FDA approved to detect signals of sleep apnea. Again, it's not a diagnosis, but I think the point is it can tell you if you're waking up a lot at night, and that might clue you to go see a sleep specialist. Like, maybe I'm not supposed to be waking up this much. And then we could get an official sleep study done to see if there's in fact a sleep disorder that's disrupting your sleep. I think that's how it should be taken.
When you diagnose someone, are you looking at qualitative factors, quantitative, or a bit of both?
A little bit of both. Quantity is more up to the patient. I always say we're going to work together as a team. So you work on your quantity, but I'll help look into the quality, because we can get the sleep study done and we can see kind of what's going on. What is it that's disrupting, and then treat the disorder that we find.
Mm-hmm. Is there like a big disconnect between what someone, like one of your patients, like if they say, oh, I sleep amazing, and then you do like the quantitative and it says the exact opposite? Does that happen often?
The opposite might happen, because generally if someone sleeps pretty fine, they're probably not going to come see me, right? But I do have people sometimes who come in and say, I don't think I'm sleeping great. My tracker is telling me that I'm not sleeping great, but then we do a study and we show that actually there's not a lot of, disruption. This is actually called paradoxical insomnia. Where you feel, or you're kind of relying on, this tracker that's giving you data that might not even be totally accurate. And even though you've gotten the in-lab gold standard study done, you still trust this over that. And that can be kind of the conflict, or, the concern with all these sleep trackers, because you also have to keep in mind, like, who's getting a sleep tracker. A lot of times the consumer that is going to purchase a sleep tracker is one that is not getting great sleep. And studies also show, they did a comparison in people who have insomnia versus people who, they call it good sleeper. And the correlation was way worse in patients with insomnia. So it's hard, because those are the people who are probably going to go get a tracker and then relying on the tracker. But then that's less accurate for them as it is when compared to a good sleeper. So it can be a little bit tough, because wellness is now the new thing, right? We all now want to get better sleep, want to have better health, want to be more productive. And so all these companies, that's what they're advertising, like, use this and get better sleep.
Mm-hmm.
But that's not always the case. And there's a term called orthosomnia, which is getting the perfect sleep. Like, if you're an orthosomniac, you basically become obsessed with getting the perfect night of sleep, which there isn't really like a perfect night of sleep. In fact, I bought one of these things when I started my training, my fellowship, and I would let it dictate my mood. I would look at that first thing when I woke up, and I would say, oh, I got a bad sleep score. And then it would dictate my mood. I would just not be as happy. But then once I stopped using it, and just focused on my habits and my subjective feeling that I feel fine when I wake up, I do better without it, actually.
Mm-hmm. Do you, so like, I guess people have like a bedtime routine, or you call it sleep hygiene routine, maybe.
Yeah.
Does like the morning routine matter as well, or not really? Or is that more for when they're awake?
Yeah, I think that could maybe set your day up. But I don't think it matters with your sleep so much. It's more the bedtime routine. And going back to the trackers really quick, not that I'm against it, I just think there's positives that have come from it too, because it could alert you that you're waking up a lot at night, and then you come in to see me, and then we realize, oh, you do have sleep apnea, and then you get treated, and okay, great, problem fixed. I just think it's got to be taken. You have to know what data you can rely on and for what purpose
What
when
are
using them.
the sleep trackers missing that you would want in addition to what already is giving you for the data?
The problem is that the way to really see what stage of sleep you're in, you have to get an EEG, which is looking at your brain waves. That's how we look at what stage of sleep you're in. So you can use all these surrogate markers to maybe guesstimate, but really to be pretty sure about what stage of sleep you're in, you have to see the brain waves. But again, I don't know that I would say these sleep trackers should do that, because I also don't want to breed a bunch of orthosomniacs where now people who don't even maybe need it are like, oh, I have to get, like, I was already sleeping pretty okay once I got my sleep habits, down. But then I got this watch and I started becoming very obsessed with the sleep score. So yeah.
That makes sense. I have a question about sleeping habits, right? There's
Yeah.
people that sleep on their sides and people that sleep on their backs. Is one better than the other?
It's hard to say because everyone has certain issues. For example, if you have sleep apnea, it often is worse when you're on your back. So if you have sleep apnea and you're not, being treated for it, it could be worse when you're on your back. But then a lot of people have joint pain, arthritis, shoulders, neck, where they find it difficult to sleep on their side. So for them, back might be better.
Okay.
I always just say try to keep your neck pretty like neutral. But again, if you have a sleep apnea or trouble breathing, sometimes people have to prop their head up a little bit. So it's really difficult to say that there's one, magic position of sleep.
Do people that sleep better age better, like in terms of looks and skin and all that?
Can sleep affect? Yeah, it can affect your appearance. Yeah. I do think that sleep affects everything in your body. You can get skin. Yeah. I think if your sleep is disrupted, you can be more prone to, like breakouts, if you're acne prone. Also, it can affect, your sugar control. It can affect your heart. People who get disrupted sleep are more likely to have heart problems down the line. So yeah, it affects basically every system in your body. I feel like sleep is at the core.
Is there any truth that sleeping next to a loved one or partner helps you sleep better at night?
There actually have been a few studies that show that you get, I think, better sleep when you're sleeping next to a loved one. I don't know how good those studies are. I'll send them to you, but there have been a few studies that show better sleep next to a loved one. Yeah.
Is there something that is released, maybe different type of hormones between the bodies, or that actually helps promote sleep better next to somebody? Is it the warmth? Is it the rhythmic breathing? I know like there's going to be some people snoring probably going to disrupt the sleep, but other times there's not. So is there something
The
to do
love,
with
man.
that?
It's the love potion.
The love potion?
I think it comes down to you're more, I guess, calm, less stressed. But there are, when you have certain feelings like love, there are certain hormones that are secreted. I don't know if those are the specific ones that would cause better sleep, but I think it comes down to just less stress.
Yeah, I like there's different I guess from how it was before versus now. We have these large houses and everybody's spread out. Like I got a pretty like decent sized house, but everybody's sleeping in different floors of the home. And I was just thinking back when we were younger, we would always want to hear stories from grandma. We'd be like, go to grandma's room. We were like 4 or 5 years old. Grandma tell us a story, and we'd wake up with so much better sleep. I don't know, maybe it's just we were kids, and as we grew up, it's different now. But yeah, man, being a kid was so much better than being a good. After listening to all this stuff, I'm stressed out. I'm like doing everything wrong.
Don't be stressed.
Question,
Just
or I guess for you, because you've done this for a period of time, like what do you want people to know about sleeping? Whether is it like
I
people should dial in their hygiene? Talk about that a
I
little
think
bit.
just make it a priority. I don't think that enough people are making it a priority. Now it's tough for people. It's easy for me to sit here and say, but it's not, it's easier said than done because a lot of people have different circumstances too, right? Someone might need to work 2 jobs, including a night shift, or so it's easy to say, you know, get your 7 to 8 hours of sleep, but it's hard with whatever, you know, whatever circumstances you might be in. Sleep equity, it's like the chance of sleep. Not everyone has the same chance. But if you do have the chance, I would say prioritize it because it really does affect your health. It really affects you from inside out. You'll see, I mean, just like you guys probably can see, if you get one night of poor sleep, you feel pretty awful the next day, right? You're groggy, you can't focus, you're kind of irritable. Imagine that's how some people feel every single day because they just are unable to get that deep sleep. And so fixing that, someone once told me they felt like they got a personality transplant because their sleep was improved. And so I would just say, if you can, try to prioritize it.
What would you recommend for brand new parents and babies trying to get optimize their sleep?
Sleep whenever you can, like sleep when the baby sleeps.
Okay.
Yeah.
That's pretty much it.
Because that becomes tough. You have to wake up and yeah, life gets in the way, unfortunately, but whenever we can, we should prioritize sleep.
Mm-hmm. Raul, how are we doing for time?
What time is it?
Yeah, let's get going. Let's
Yeah,
get going.
I
Let's
got
wrap it up.
100 questions
Let's
I
wrap
want
it
to
up.
keep going, but then I want to be aware that you have some things too. Is there any I guess just to wrap a couple things up, and then Rahul, I'll let you take it home. Is there 3 things that I can do tonight to make sure that I wake up as refreshed as the best version of myself tomorrow morning? Or is it going to take like a week of consistency of doing it, a month?
It's probably going to take a little while of consistency. I think the biggest thing is sleep time and wake time. If you can keep it the same, that's going to help. Sleeping in a cooler environment can help also. Maybe lower the temperature a little bit. And then you can try what I do. You can try dimming the lights before bed, 2 hours before bed.
Or dimming all the lights and then just,
yeah.
What about screen time?
I would advise against it because light is a wake promoter, right? So maybe right before bed, you could try reading or listening to a podcast is fine.
Listen to the Unconventional podcast.
I got one last question and then we'll wrap it up. Does sleep affect men and women differently?
That's a good question. Does it affect? I think there are different factors in women and in men that can affect sleep. But I think sleep does the same for women and men, if that makes sense. Women also have, you know, a different, like a monthly hormonal cycle, which can affect sleep. And then there's other hormones in men like testosterone that can affect sleep. But sleep does the same for both men and women, if that makes sense.
Mm-hmm. Yeah, recovery and whatnot, whatever happens in the body.
Yeah. Yeah, that deep sleep is really what you need to kind of feel refreshed. And it ends up being, it's kind of protective. You know, we all mammals sleep. So we figured out that we need it, right? Otherwise, by now, no one would be sleeping. So our bodies need the sleep. And that's why now studies show that people who get disrupted sleep or not enough sleep, they're having a lot of health problems later on in life.
Awesome. I think we'll leave it there unless there's something else you want to add, Upneat. Is there anything else you want to add?
I don't think so. I think we covered a lot.
I think I
Thank
got
you,
all my
guys.
wild questions out of the way.
Yeah.
All the curiosities. I do have one thing to ask. Is there
Yeah.
anything we can help you promote your business, help you promote people with sleep, somewhere where we can redirect people to make sure that this is the person that to go to talk to about sleep?
Oh, yeah, you could send them to my Instagram
Mhm.
or TikTok, same, sleeping.beauty_MD.
Fantastic.
Yeah. Thank
Cool.
you, guys.
I think that wraps it up. Sleeping Beauty, Upneet Chawla. What a great name. Can't believe you got that one. You beat Disney out to it.
I guess the MD, you know, I got
Yeah. Well, that makes sense. Awesome. Thank you so much. I
Upneat,
can't-
thank you so
Thank you.
much.
Do you think we're
Thank
gonna do? I
you.
feel like we need to do a round two. I'm gonna be experimenting on a couple of things. And I'll reach
Somebody please just prevent Rahul from sleepwalking.
I'm gonna
and
sleepwalk.
I'm concerned for his safety.
Awesome. All right, guys.
All
Thank you
right,
very
thanks,
much.
guys. Yeah,
We'll
thank you,
we'll
Upneat.
have
I
this
appreciate it.
uploaded and then
No
hopefully
problem. Nice
yeah.
meeting you guys. Take
Bye.
care.
Okay, bye, guys.
Bye. Let's see. Bye.